The news this morning about antibody testing for COVID is that the sensitivity of such tests are around 95% and the specificity is around 90%. What this video is about is exactly what this means. You probably can look up and see that sensitivity is what's called the true positive rate, and specificity is what's called the true negative rate. That is that 95% of known positives will show up positive, and 90% of known negatives will show up as negative. Now, that doesn't seem too bad on the face of it, but it turns out the value is really dependent on the prevalence. We call this the predictive value. So I'll do some calculations here to show you what this really means. So let's say the prevalence is around 5%. It's a matter of debate as to what it really is, and that's why I want to do this calculation. So let's say 5% of those in the general population actually have been exposed to COVID, and some time has passed so that the antibody IgG has actually appeared in their blood. So that means if I make a table here of the truth, that means if I test 1,000 people, I should end up with 50 that are true positive and 950 that are true negatives for the total of 1,000. So I'll mark these as the positive and these as the negative. Now I'll do my antibody test. And since it's only 95% sensitive and 90% specific, we won't get exactly these numbers. Based on the 95% sensitivity, I should only get 95% of 50 to show up as positive with my test. And ends up being around 48 if I round the numbers there. That means 2 will show up negative based on my test. And that's how you get the 95% sensitivity, because it's 48 divided by 50. In the case of the negative results, I'm going to get a 90% specificity, or 90% of these true negatives will show up as negative in my test. That ends up being 855 of those 1,000 patients will show up negative in my test, and the balance will show up as positive. So now if I sit back and ask how well my test is doing, the first thing I'm going to say is, well, of the 1,000 patients, how many showed up positive by my test? Well, there are going to be this 48 that are true positive, plus 95 that are false positives. They're really negative, but they showed up positive by my test. So that's 143 total positives. If I look down at the negative results, you see here, the total number of negative results is going to be 857. There are 2 of them that showed up negative in my test, but that were really positives. So these are false negatives right here. How do I make sense of this? Well, the first thing I do is calculate what's called the positive predictive value. So that is, what's the value of the positive test result that I get from my test? That's the ratio of how many tests that showed up positive by my test out of all the positive test results that I got. So that's 48 over 143, which ends up being 34%. So the positive predictive value of this test, despite it being 95% sensitive, is only 34%. This means a positive test from the testing of an individual patient only has a 34% chance of actually being positive. The negative predictive value, though, is quite good. Why do I say that? Because the negative predictive value is the ratio of those that are truly negative divided by all the negative results that I got. So that's 855 divided by 857. And that ends up being 99.8%. In other words, a negative test result from an individual patient has a 99.8% chance of actually being negative. Now, all this hinges on the prevalence. So let's repeat this analysis for a prevalence of 30%. So I'll create the same table, but now instead of being 50 true positives, there's going to be 300, 30% of the same 1,000 patients. And the true negatives will be 700. My test results, again, we're using the same test. So it's 95% sensitivity and 90% specificity. Exactly the same test. The only difference now is the prevalence in the general population. So 95% of 300 is 285. And that means 15, the difference between 300 and 285, will show up negative on my test. Those would be the false negatives, of course. On the true negatives, we have a specificity of 90%. So 90% of 700 ends up being 630. And the difference will be 70. So that's my false positives there, right? They showed up positive in my tests, but they were actually negative. So now when I total across the columns here, the total number of positive tests that I expect to get will be about 355, the sum of these two. And the total negative results that I expect to get will be 645, the sum of these two. So now what are my predictive values? Well, the positive predictive value, of course, is the ratio of the number of positive results that I got that are truly positive divided by the total positive that I found in my tests. So that's 285 divided by 355. And that's 80%. The negative predictive value is the number of negative tests that were truly negative, 630 in this case, divided by all the negative tests that I found, which is 645. So that's 630 divided by 645, which equals 97.7%. So the point is that the same test applied to two different prevalences gives very different predictive values. So if I want to interpret the results of this test, I need to make some assumptions about the prevalence in the general population. If I assume that the prevalence in the general population is only 5%, that is, only 5% of the general population has really been exposed to the COVID virus, then the value of a test on an individual patient that shows up positive is only 30%. That is, there's only a 30% chance that that patient is really positive. However, if the prevalence is 30%, that is 30% of the general population has been exposed to the virus, and it has been sufficient time for IgG antibody to appear, and then the value of a positive result for a given patient is quite high. It's around 80%. So I hope this helps you understand these numbers, sensitivity and specificity, that they're great when you know what the result is. But when you don't know what the truth is, like just taking someone in off the street, you have to make some assumptions about what the likelihood is of exposure in the general population. Hope this helps.